Hi, my name is Capricorn Hivo, and I'm going to talk about immunotherapy in renal cell carcinoma and ribavirin for chronic hepatitis E virus infection in transplant recipients. Definition. What is renal cell carcinoma? Renal cell carcinoma is heterogeneous and comprises several histological cell types with different genetics, biology, and behavior. Many of the oncogenes and tumor suppressor genes that are mutated leading to the pathway dysregulation in renal cell carcinoma remain to be elucidated. Immunotherapy is defined as excluding cancer by activating the autoimmune response against the tumor rather than by attacking the tumor directly. Immunotherapy can induce long-lasting anti-cancer responses owing to the regeneration of antigen-specific immune memory, either through memory T cells or antibodies. Ribavirin in hepatitis E. First, hepatitis E is a liver disease caused by infection with a virus known as hepatitis E virus. The virus has lists for different types, genotypes 1, 2, 3, and 4. Genotypes 1 and 2 have been found only in humans.
Hey, thank you for watching Medicosis Perfectionalis. Hepatitis E mnemonic. The E mnemonic, also known as the EU mnemonic, coming up. Hepatitis E. Remember, EU. It causes jaundice in the Far East, Egypt, and by Egypt I mean Africa. And by the way, Egypt is my home country. India, Central America, contaminated water, ew, contaminated is ew, undercooked seafood. Sometimes some genotypes of Hep E are endemic in the swine. So undercooked pork can cause Hep E hepatitis. So swine, pigs eat everything, including garbage and worms, so that's ew. No offense to pigs. Fecal-oral route of transmission. Sometimes it's common in pregnancy, and when it comes to pregnant women, it's fulminant. Fulminant means massive necrosis, which can lead to failure. Ew. And there is marked cholestasis in hepatitis E. Mostly it's acute. In these countries, sometimes it's the most common cause of acute viral hepatitis. Wow. But, however, it also can be chronic, such as patient with HIV or patient with immunosuppression. Some textbooks, including Harrison's, which is my favorite book, I will link it in the description.
Applications in medicine. Renal cell carcinoma usually presents prominent immune cell infiltration, including T cells, natural killer cells, disease, and macrophages. During early stages, malignant cells can be poor stimulators and become resistant to the innate immune response. Later, progressively, growing tumors impairs the adaptive immune response by blocking T cell signal transduction and function.
Checkpoint inhibition, that is actually a form of immunotherapy. So that whole class of therapy, what it essentially does is ramps up your own immune system and releases the brakes that the tumor created to slow down your immune system from fighting your own cancer. It lets go of the brakes so that you can fight the cancer yourself. And when it works, it is actually astounding. It's really quite remarkable. It doesn't work for everybody, but when it works, it's really quite remarkable. Well, interestingly, checkpoint inhibition, again, this immunotherapy approach, that has exploded on the scene for bladder cancer as well. And that is rapidly changing the paradigm for the management of advanced bladder cancer. And so there's active trials ongoing right now trying to figure out exactly what space that therapy should fit in. Should it just be in metastatic disease, or does it have a role in locally advanced disease, or even earlier stages? So that is probably the single biggest advance in the last couple of years, and it's just taking bladder cancer by storm.
Immunotherapy. Though there are different types of immunotherapy, they all work in the same way. They get your body's immune system to fight cancer cells. What you can expect for treatment though depends on which type of drug you get. There is a checkpoint inhibitors like PD-1 inhibitor like nivolumab, CTLA-4 inhibitor like ipilimumab, and the other ones like cytokines, interleukin-2, aldesleukin, and the interferon alpha. Applications in medicine of ribavirin. In hepatitis C virus, genotype 3 causes self-limiting infections in non-immunocompromised patients. However, it can lead to chronic hepatitis and cirrhosis in patients who have received solid organ transplants, patients with human immunodeficiency virus infections, and patients with hematologic cancer who are receiving chemotherapy. Pros and cons. Pros. Immunotherapy may work when other treatments don't. It can help other cancer treatments work better. It causes fewer side effects than other treatments, and your cancer may be less likely to return. And the cons, you might have a back reaction, maybe could hurt, itch, swell, turn red, or get sore in the area where the medication goes. Some types of immunotherapy rev up your immune system and make you feel like you have the flu, complete with fever, chills, and fatigue, in other cases diarrhea. The renal cell carcinoma, it can develop in von Hippel-Lindau syndrome.
I think the most interesting data and the one that people are very excited about is the Emotion 151 that we just heard from Dr. Bob Moser. And this is a phase 3 randomized trial that looks at bevacizumab with atezolizumab versus sunitinib in a phase 3 setting for advanced metastatic clear cell kidney cancer. So let me just give you a little background on how we treat kidney cancers or advanced kidney cancers. So certainly there has been a lot of landscape changes. In the past, if we go back even a decade ago, we really did not have a lot of systemic therapies to offer. But now we have VEGF inhibitors, so these are what we call the TKIs. And certainly we have the immunotherapy drugs, but mostly for second line right now. So with the advent of these trial, the landscape of treatment is really changing. So in this phase 3 trial, though, what they saw was a phenomenal and very compelling improvement in the progression-free survival. The overall survival is yet immature, but we are seeing that there is 2 co-primary endpoints. One is progression-free survival in patients who are PD-L1 positive, and in this population, there was about 40% of them, as well as an intent to treat population. And what they found was the PFS, for instance, for the combined therapy is in the order of 11.2 months, compared to only about 7 months for the sunitinib arm. So these are compelling data. And in terms of toxicity, actually there's not a whole lot that it's unexpected, if you will.
Pros and cons. In ribavirin, in patients chronically infected with hepatitis C virus, viral clearance should be a goal to avoid potential progression of liver fibrosis and extrahepatic manifestations. Ribavirin therapy was associated with a sustained virologic response in 78% of the patients. Among patients who have a recurrence and complete a second and prolonged course of ribavirin, a sustained virologic response could be achieved in most patients, and higher lymphocyte count appeared to be associated with a sustained virologic response after ribavirin therapy.
Hepatitis E virus, referred to as HEV, is a common cause of sporadic and epidemic acute liver disease in developing countries. In the United States, sporadic cases of both imported and locally acquired HEV infections are mostly seen among adults. Incubation ranges from 15 to 60 days following exposure, with an average of 40 days. Liver enzyme elevation, as shown in blue and labeled ALT for alanine aminotransferase, usually occurs 4 to 5 weeks after exposure to HEV and persists for 3 to 13 weeks. Symptoms noted by the purple bar occur when liver enzymes are elevated. Virus excretion in stool, illustrated by the orange bar, is variable, but usually lasts from about 1 week before symptoms appear until about 1 week after they have surfaced. However, this time frame can be longer in some people. Viremia in acute self-limited infections, shown by the green bar, can be detected about 3 weeks following exposure or a week or so prior to onset of symptoms and lasts for about 2 weeks. Antibodies to HEV, both IgM anti-HEV, depicted by the pink hatched line, and IgG anti-HEV, illustrated by the black hatched line, are usually positive about 3 to 4 weeks after exposure. IgG anti-HEV persists, but IgM anti-HEV declines rapidly during early convalescence and is usually negative by 13 weeks. HEV serum
Issue applied in Ecuador. This study aims to establish the overall survival and time to progression in patients with metastatic CRCC treated with sunitinib. The medical records of 42 patients with a diagnosis of metastatic clear cell renal cancer treated with tyrosine kinase inhibitor sunitinib in the oncology service of Hospital Carlos Andrade Marin are reviewed. The results of analysis of time to progression in the patients treated with sunitinib was similar to the reference studies and international oncological management guidelines. In terms of survival, a favorable result was obtained. However, the results are still not conclusive.
I think it's a truly exciting time. I mean, bladder cancer has been pretty much neglected for decades. We only had cytotoxic chemotherapy that had some modest efficacy, I would say, in patients, and now we are witnessing a true revolution with the approval of 5 immunotherapies. We are still, I think, working our way through in how to best identify patients who may benefit from these therapies and how to improve these therapies. But I think we are witnessing very durable responses in a subset of patients who can benefit from these therapies for years with really sometimes minimal side effects. I think this is truly gratifying for any medical oncologist. So kidney cancer has always been kind of like a immune responsive tumor. It's really the only other cancer where we have essentially old-fashioned immunotherapy a la high-dose interleukin-2, similar to what we use in melanoma, approved with long-term benefits. So since November 2015, we have nivolumab approved, a PD-1 inhibitor, and we do know that we can induce very durable responses in a small subset of patients, around 21% of patients. However, simply speaking, it's not enough. And I think the future is going to be to look at combination therapies. This will come forward in the short term, I would say, in 2 different flavors. One is the combination with VEGF inhibitors, and the other one in combination with another immune checkpoint inhibitor called CTLA-4 inhibitor, or Yervoy. And I think we will witness in a very short amount of time how the first-line therapy for kidney cancer is going to be transformed. It's going to be driven by immunotherapy, truly.
In ribavirin, every year there are an estimated 20 million of hepatitis C virus infections worldwide, leading to an estimated 3.3 million symptomatic cases of hepatitis E. Conclusion. Novel immune therapies are emerging as an important addition to targeted therapies in the treatment of renal cell carcinoma. Many questions regarding their use remain to be optimized, including dose, schedule, AEs, and adjuvant or non-adjuvant applications. An investigation of the rational combination of different treatment modalities is also critical in maximizing the potential of immunotherapy. The conclusion of ribavirin as a monotherapy may be effective in treating chronic hepatitis E virus infection. A 3-month course seems to be an appropriate duration for this therapy, though a longer therapy can be given to heavily immunosuppressed patients and those who still have viremia 1 month after the initiation of therapy. However, prospective studies are required to determine the most beneficial dose and duration of ribavirin therapy. Thank you.